A very good morning, students. Okay, this video is for the question asked on the kidney. Okay, while during the practical examination in anatomy, kidney is very often asked by the examiners. So, examiner can ask you to hold the kidney in the hand and tell the various answer the various questions. For example, the first question may be that what is the location of the kidney in the abdominal cavity? So you should answer that the kidney is a bean-shaped organs. It is bilateral organs located on each side of the vertebral column in the posterior abdominal wall. Okay, on the posterior abdominal wall, and this organ extends from the level of T12 vertebra, that is thoracic 12th vertebra, till it goes right up to the lumbar 3rd vertebrae. Okay, and if you see the location of the kidney in relation to the various regions of the abdominal cavity, then it is located in the epigastric, hypochondriac, lumbar, and umbilical region. That means the upper four regions, okay, where at its intersection the kidney is located. Some of its part are projecting in the epigastric, some of its part in hypochondriac and in lumbar and the umbilical region on each side, right side as well as the left side region. Now, the body of the kidney, okay, are the body of the kidney on the right side is at a lower level as compared to that of the kidney of the left side. This reason is that he may ask why the body of the kidney is at a lower level on right side as compared to that of the left side. The reason is that on right side there is the presence of a large organ in the upper abdominal cavity, that is the liver, and because of that the right kidney is at a lower level as compared to that of the upper. Then another important question an examiner can ask you, describe the external feature of kidney in brief. You can say that by holding the kidney in your hand, you can say that kidney has an upper end or the upper pole, superior pole, and an inferior pole. So there are two poles, superior and inferior pole is there. The superior pole is tilted more towards the median plane as compared to the lateral pole, inferior pole or inferior end, which is more towards the lateral side. Now, then you can say that there are two surfaces. There is an anterior surface and a posterior surface of this bean-shaped organ is there. How you will differentiate the anterior surface, he may ask you. You can reply that the anterior surface is usually convex while the posterior surface is the flat surface in both the kidneys, right as well as into the left. The posterior surface is flat while the anterior surface is that of the convex surface is there. Then you can say that there are two borders, a lateral border which is convex and a medial border which has an indentation in the middle which is called as the hilum. You can say that. Then he may ask you what may be the relation of the right and the left kidney on posterior surface. The relation of the right and the left kidney on posterior surface are common, almost common. There is no difference in the posterior relation of the kidney. Now, these are the posterior surface is in relation to this near the upper part. It is in relation to the suprarenal gland. Okay, near the upper pole, it is in relation to suprarenal gland. The suprarenal gland has been removed from here, from the upper pole, but you will see that below on the posterior surface, the uppermost part near the suprarenal gland is in relation to the diaphragm. Then there are three muscles which are in relation to the lower part of the kidney, that is more medially towards the hilum is the psoas major, then comes the quadratus lumborum, and more laterally it will lie onto the transversus abdominis. So diaphragm, then the psoas major, quadratus lumborum, and then the transversus abdominis muscle. Then the nerves and vessels which are in relation to that, the uppermost is the subcostal nerve, that is T12, and subcostal vessels, and then L1 and L2 nerve, which will lie that is L1 is the iliohypogastric and the ilioinguinal nerve. They will be lying on its posterior surface. So the posterior surface in the right and left kidney, they have the same relation. But then the relations on the right side and left side on its anterior surface will differ. You can say that on anterior surface, this is, say for example, if it is right kidney, it will have a relation with the suprarenal. This is in relation with the hepatic or the liver. This is in relation with the second part of the duodenum. Then this will be for the ascending colon and the colic flexor, that is the right colic flexor, and then a small area near the lower pole is in relation to that of the intestine, that is the jejunum. So on to the left side, it will be the same suprarenal gland. Then this will be with the spleen here. It will be in relation to the stomach, and then there is this middle part is in relation to that of the pancreas, and then this will be with the help of it will be in relation to the jejunum, coils of jejunum, while the outer border near pole will be in relation to the left colic flexor. Left colic flexor. So these are the visceral relations. Then an examiner can also ask you what or how you will determine the side of the kidney, which is an important. And for determination of the side, you have to look at the hilum of the kidney. At the hilum of the kidney, more towards the anterior surface, you will see that there is a vein which is called as the renal vein. Deep to the renal vein, the second structure at the hilum from anterior to posterior side will be that of the artery, and this is called as the renal artery. And most posteriorly in the hilum will be the pelvis of ureter, and the ureter will go downward. So this is the ureter, where the dilated part here is the pelvis. This is true for right and the left kidney. This is the renal vein, renal artery, and this is the dilated pelvis of the ureter, and then this is the ureter that will go downward. Second important thing which you should also see, that the upper ends are broad as compared to the lower end. See this broad end, and this is the lower pointed end, but it's not always true. But on anterior surface there is convexity, while the posterior surface are flat. See the convexity, and the posterior surface are usually flat here. So these are the structures, points by which you can find out which is the what is the side of the kidney, whether it belongs to right or to that of the left side. Okay, to that of the left side. Then how to keep this organ into anatomical position. Now this organ, to keep it in anatomical position, keep to the side which it belongs. See this is the upper pole, this is lower pole, this is the convex upper pole is here, lower pole is here, this is the convex anterior surface, this is the renal vein, this is renal artery, pelvis and ureter, which will go downward. That means this is the left kidney. Okay, this is the left kidney, and for its anatomical position, the kidney has to face, anterior surface actually faces anterolaterally, and posterior surface faces posteromedially. So the hilum faces anteromedially. So it is not like that. You have to tilt it so that the posterior surface is posteromedial and anterior surface is anterolateral surface. That will give you the correct anatomical position. Another point which you should keep in mind is that the superior pole should be more medial as compared to that of the inferior pole, which is more lateral. This completes the Viva on to the kidney. Thank you very much for watching this video.